Dr. Sen, let's talk a little bit about a certain condition that affects a lot of people, and that is stroke. Can you talk about what some of the risk factors of that are, and basically what stroke is in general?
So first of all, stroke of the brain refers to a blockade of a fine vessel that supplies the brain. The brain, as you know, is a very active organ. It's a vital organ supplied by very fine blood vessels. And the fineness of the blood vessels is an advantage because the thinner walls of the fine vessels allow for rapid and efficient transport or transfer of nutrients and gas, and that's how blood-borne material can be delivered to the brain in a very fast and efficient manner. The downside of it is that since they're so fine, they lend themselves to blockade, especially if you have sticky substance in your blood. This could be certain clots, or this could be you had a plaque somewhere else in the body, and a little bit of that plaque got loose and was flying through your blood vessels, and everywhere else it was fine. But now that it reached the brain, in the fine vessels, it got caught, and now a focal part of the brain gets deficient supply of blood, and therefore all blood-borne factors. And that's usually what is referred to as stroke. Stroke actually comes in two forms, generally speaking. One is ischemic stroke. That's what I refer to right now, where you have a blockade. The other is hemorrhagic stroke, which is where a fine blood vessel actually ruptures, and now you have bleeding in that area. That too, downstream of the blood vessel, because now all the blood is being spilled out, has ischemia, or not enough perfusion by blood. But over 3/4 of all stroke is ischemic, and less than 1/4 of all stroke is hemorrhagic.
Okay. Talk about some of the risk factors. You mentioned something sticking in the blood or sticky blood. What are some of those risk factors? We hear a list of them. Is genetics one of them as well?
Yeah, so the risk factors associated with stroke are well studied, and they are quite a few. Generally speaking, blood lipid profile is a big deal. If you have a lot of bad cholesterol versus good cholesterol ratio is on the undesirable side, so that's the bad news. A lot of people that don't exercise will have lower levels of good cholesterol. Much depends also on your eating habits. And with respect to genetics, there are two general comments I can make. One is, your lipid profile in some ways could also be determined by your genetic background. But then a more relevant factor in stroke that actually accounts for much of the stroke in young is the fact that some of us, compared to others, have finer blood vessels. You will see when you go to the nursing home or a hospital and they try to draw blood, some of us are very easy to draw blood from, while others, that nurse, well trained, can't even find the vessel. They're poking here, poking there. It is just that some of us don't have wide and big blood vessels.
Sure.
And those people, if they have other risk factors associated with it, they could lend themselves to having more stroke than others.